Hi, my name is Jenna Henderson. I'm from Georgia State University, and I'm going to be presenting on the variability of response to whole body vibration and treadmill walking in ambulatory children with cerebral palsy. Single bouts of whole body vibration have been reported to acutely decrease spasticity and improve isolated active range of motion in children and adults with CP. The effects are usually transient, but some authors have stated that these acute effects could help promote children's active participation in exercise, suggesting that whole body vibration might be most effective as a preparatory modality, used to temporarily minimize spasticity and then combined with other rehabilitation techniques to maximize their potential benefits. Treadmill training is a really popular intervention technique in pediatric rehabilitation, and it's great because it allows for the practice of walking in a really controlled environment. So the purpose of this study was to compare the acute effects of a single bout of treadmill walking to a single bout of whole body vibration followed by a single bout of treadmill walking on the lower extremity muscle spasticity and overrun gait pattern in children with cerebral palsy. We hypothesized that the whole body vibration but not treadmill walking would decrease like muscle spasticity, and that overgrown gait would improve following both interventions, but that the improvements following the combined intervention would be greater. To investigate this, we recruited 9 children with cerebral palsy, GMFCS levels 1 through 3, with a mean age of 11.4 years. Our experimental setup looked a little bit like this. We took a pre-measurement and then completed a 10-minute bout of treadmill walking and then did a post-measurement, after which the subjects rested for 20 or 30 minutes. We then took another pre-measurement and completed our combined intervention of whole body vibration followed by treadmill training and took a post-measurement there as well. For whole body vibration, we had the subjects complete 12 minutes at a frequency of 20 hertz and an amplitude of 2 millimeters. And we collected spasticity variables using the modified Tardo scale and the Wartenberg pendulum test, and then calculated spatiotemporal variables and joint kinematics at the hip, knee, and ankle. We found no differences in group level means between the two interventions for any of our variables related to spasticity or gait. However, when we examined the results at an individual level, we found a significant amount of inter-subject variability. The results presented here are a small sampling used to illustrate the variability across all subjects. So these graphs are representing the R1 joint angle from the modified Tardo scale, which measures plantar flexion spasticity, overground step length, and overground walking speed for 3 different subjects. So as you can see, the subjects responded very differently in terms of spasticity. Subject 1 decreased spasticity after treadmill walking, but had no change after whole body vibration. Subject 7 decreased spasticity after both interventions, and subject 8 had no change after treadmill walking, but then decreased after whole body vibration. The step length response was similarly variable. Subjects 1 and 8 increased their step length after both interventions, and subject 7 slightly increased after treadmill walking, and then decreased back to baseline after whole body vibration. For walking speed, subject 1 decreased walking speed after treadmill walking and then increased after whole body vibration. Subject 7 decreased walking speed after both interventions, and subject 8 increased walking speed after both interventions. So in addition to the different response patterns between subjects, you'll notice that the same subjects didn't respond in the same way in terms of changes in spasticity and gait parameters. That is, changes in the former were not highly correlated with changes in the latter. So in summary, we found that the individual response to both of these interventions was highly variable. More interestingly, the variability of response was not highly correlated with age, motor ability, or baseline spasticity. With high individual variability and no group level differences, it's difficult to fully evaluate our hypotheses. However, trends in the data suggest that our hypothesis that only whole body vibration and not treadmill walking would affect leg spasticity may be incorrect, as some subjects decrease spasticity following each intervention. Our hypothesis that the combined intervention would be more effective than treadmill walking alone may also be incorrect, as some subjects responded equally to both or responded poorly following whole body vibration. So overall, notable improvements in spasticity and gait were seen in some subjects following whole body vibration, prompting us to say that it's still a promising modality to reduce spasticity in children with cerebral palsy. However, significant further investigation is needed to understand the variability in individual response. What makes some children respond favorably to whole body vibration and others respond not at all? A more in-depth understanding of this variability may be needed before whole body vibration can effectively be compared with other interventions. If you have any questions or comments and would like to discuss this work, the contact information for myself and one of my co-authors can be found at the bottom of the slide here, and we look forward to hearing from you. Thanks so much.